All right. Hello, everyone. I'm Carissa Wong. If we haven't met, I'm the nursing practice consultant with the Nursing Directorate. Welcome to our Spotlight month of March, which is Mauvais sang dans le tube, wrong blood in tube. It's a 45-minute presentation. I booked 45 minutes with us. We're at 40 people. It's recorded, so if ever, this will be available on the internet afterwards as well. Before I start, I will actually just right off the bat launch a poll to the group. It seems like Kahoot is a regular part of these spotlights now, so I'd like to know if you'd like to do the Kahoot now or towards the end of the presentation. The Kahoot questions are general questions related to the ROP and some history lessons, so it's nothing that you would not know now or at the end. So if you can submit your answer. Okay, we have almost a tie, 30 responses. Okay, so I'll start the Kahoot now. I'm going to share my screen for the Kahoot so that you can join. It is coming. Okay, so you should see a screen come up right now with the Kahoot PIN number and the QR code. If you're just joining, I'm sharing the screen and we'll start with the Kahoot first. Not too long. Okay, we're at 29. We're more than half, so I'll start and feel free to join in as we go. So first question. Réactions transfusionnelles sont déclarées à INSPQ et à la biovigilance du MSSS. Dépendant de la sévérité, elles sont aussi déclarées au Héma-Québec, Canada Vigilance, Santé Québec, puis toutes les réponses. So that is correct. It's toutes ces réponses, Héma-Québec, Canada Vigilance, and Santé Québec. True or false? Transfusion Medicine Committee and Transfusion Safety Officers were created following the HIV and Hep C contaminated bloods. True or false? So at the MUHC, we have a Transfusion Medicine Committee that's chaired by Dr. Pelletier with various stakeholders. And there's clinicians and people called transfusion safety officers. So that's correct. It's true. Those rules were created after that. Question 3, multi-select option. Produit stable, so PS as abbreviation, albumin et immunoglobulines, les facteurs coagulation sont considérés comme les produits stables. Pourquoi? dérivés du plasma, ils sont distribués par la pharmacie ou ils sont distribués par Emma Québec? It's well, that's correct. That's correct. Dérivés du plasma, puis ils sont distribués par Emma Québec. Fourth question, when and where do you place the label on the blood tube? Before blood draw and at the nursing station, before blood draw and at the bedside, after blood draw and at the nursing station, and finally after blood draw and at the bedside. So that's correct. It should always be done after the blood draw and at the bedside to ensure that the identification process is followed. Fifth question. Multi-select, le bracelet d'identification du patient ne doit pas être placé sur le poignet du soignant, sur le patient, sur le lit collé au lit, ou collé au lit, ou sur le dossier. The question is not be placed on where. It's a multi-select. So that is correct. Final question. Multi-select again. What are appropriate double identifiers when drawing a type-in screen? MRN and full name and room or exam room number, full name and date of birth, full name and parent's full name. So that is correct. MRN and full name or date of birth. So thank you for participating. I really want to say shout out to Erin, Jeanette Colin, Bernard, Erin Alexander, who helped develop these questions for us today. This Kahoot is available on the internet, so feel free to use this Kahoot with your staff if it's appropriate. Congrats, Ale, Velaris, and Kay. Okay, I will share my screen now for blood and tube. I don't see everyone on my screen, so if you have questions, I'll try to keep an eye on the hands and the chat as much as possible. I'll start with a video. I learned sign language for this spotlight. So this is just for you to start guessing what I'm trying to communicate with you in this image. And I'll share the information towards the middle of the presentation. Before we start, here's really a picture in real life at the MUHC over the last year. And these 4 examples are real examples across all our sites of the events that had happened in terms of a mismatch in requisition or a wrong blood and tube that has been identified. First example, a unit was really busy. There were 2 patients admitted at the same time. Therefore, the labels were placed in the wrong requisition. There was another common example where there was distraction on the unit when blood draw was being done. So it created an error. There was also identification of the tubes that were mislabeled. So either missing signature, missing a name or a time, or the names were mislabeled. Another true life example. And finally, in certain units, sometimes there are patient cards that are in the patient holder, and they were very close to each other. So out of a good intention of someone trying to help a colleague, a wrong card was taken and stamped on the requisition. And these are one of the very few examples that have of real situations that happened this last year. 35. So this is the number of raw blood and tube events that we have this year. And for sample errors, 611. So I'm going to launch another poll now. Do you think it's an increase or a decrease from last fiscal year? It's going to come in a few minutes. Increase. So do you think if this is an increase in rates compared to our last fiscal year or a decrease? It's coming your way. Okay, I see 33 responses, and you're correct. It is unfortunately an increase from our previous year. Just a recap, I think we know this. What is raw blood in tube? It's really when the blood in the tube does not belong to the patient who is identified. And then there are also mismatches in requisitions or errors. And what could that be? It's labeling, a sample error. Maybe there's something absent on identification of the requisition. There may be certain parts of the requisition that has not been completed. So those are some of the errors that are also flagged. Again, this is really a tip of an iceberg because this is data that we are tracking in terms of from blood bank, but there are definitely a lot more different types of blood draw that we do as an organization. So it might really be a tip of an iceberg. What are our targets again? For sample errors, 1 error out of 150. And for raw blood and tube, it's 1 error out of 3,500. Those are our targets as an organization that we're trying to meet. What does it mean for us over the last 5 years? In this graph, in this table, what you will see is the different years. The first row for raw blood and tube is the frequency. So how many times did it happen in the last year, which is 35. When we convert it into a rate, so we convert the values so that we can see a trend, it equals to 3. So which means 3 samples out of 3,500 is a raw blood and tube. And the number we are aiming is 1 out of 3,500. So as you can see, we've definitely increased from last year and close to our top 3 highest rates. Same principle for sample error. Again, these are the years. This is the first number as the frequency of occurrence. And when we translate it into a rate, it's at 2.3. As we can see blood sampling has definitely increased a lot from 430 samples to 611 in 2024. Who was involved in these errors? As you can see, there's different professional categories. What is new for 2024, there were incidents where a physician and a respiratory therapist has been involved, and these were events that happened in the operating room, hence these 2 new categories. But otherwise, we can see that the majority, the highest is our nursing titles. This is by mission. So again, I'll walk everyone through the table. First, it's a mission across MUHC, and you'll see the first group of rates is for sample error for 2022, 2023, and 2024, so that you can compare your trend over the last 3 years. And the second group of tabling is for raw blood and tube. And once again, you can compare your last 3 years to see what the rates are for your mission. Before I move on, I did not show it here, but on the intranet page, which I will show after, you will see each table for your specific mission. And then from each of the tables, you'll be able to see the number of samples that was drawn in your mission, and you can compare the rates throughout the years, and it's outlined in all the different units that have blood draw. For certain ambulatory sectors, because there's not a lot of blood draw, they may have been grouped together in the table. However, if you're curious about a specific value of your sector, please feel free to reach out to myself, and I'll be happy to pull that data specifically for you. So I'll show on the internet later on how to access that. A second part of what we looked at is incident reports. Oh, and last thing, my apologies. For raw blood and tube, the results are by calendar year, meaning from January 2024 to December 2024. Those are the rates. So actually these, the latest numbers is really fresh off the press from January of 2025, where we got all our results for last year. For incident reports, we've looked at data from the 2 fiscal years, 2023, the full year, and for 2024, we had data from P1 to P6 so far. From that, there were 378 incident reports that were under the category of diagnostic laboratory tests. And what I've done is that for every incident, I recategorize each incident into 5 different categories. First category is in reports that are related to identification process. Second category is when there's an error or something that happens throughout the blood sampling process. Third is raw blood and tube. Fourth is other. So examples of other is a bag of label is sent through the pneumatic tube through the pharmacy by error, or blood samples were found on the counter, and by the time it reached the lab, it was the test was not good anymore, so a repeat may have been required. So those are some examples of what other means. And then there's a group of incident reports that are not applicable. Once that exercise is done, then we refilter it back by the fiscal year. So in 2023, we had 241 cases, and 2024, 107, keeping in mind that it's only results from P1 to P6. And then finally, the results. This is a picture, and what I'm just showcasing here is that for the 2 fiscal years, we see that the dark blue color is the highest percentage, 35% and 39%, and that represents incident reports that are related to identification process. Again, in this table, I'll walk you through, again, it's the first side is 2023, second side 2024, and what you can see is a breakdown of each mission, surgery, machine, medicine, and each color in the bar represents the percentage of errors related to that type of error. So for example, the blue here is identification, red is a blood sampling process, and so on. And you can compare this for your 2 fiscal years. Once again, not surprising, the most of it is the blue, the darker blue, which is identification errors across most of the missions. You may have recalled our colleagues in transfusion safety had done an audit on the various sites, and they had done audits at the bedside when a transfusion is administered. And we can see from these audits of last year that one of the lowest, the non-conform lowest is verification at the bedside. So these results are also available on the intranet for you to refer to. At the end of the presentation, I'll share on the intranet so I can direct to the group on where to find the results. All right, so I'm back to this. I'm going to launch a question to you. What am I trying to communicate with you in sign language? You can type in what you think I'm trying to communicate to you and submit, and it's going to generate a word cloud. Blood tests, be safe, be careful, the importance of double identification, good guesses, check your labels, hi, 10 responses so far. I'll give a chance for a few more people to answer. All right, so I'm not an expert in sign language, and I really tried to do this on the spot. So I'm really just saying, hi, my name is. I didn't get to learn the alphabet of how to spell my name yet. So really what I want to highlight in this slide is some questions for reflection, perhaps with your team or as discussion points related to patient partnership. 3 questions that may or may not be relevant, but how would you communicate the deaf with the hearing in the hospital? And how would your team engage in an identification process with this population? A second question is, what happens in the process when someone is identified as inconnu? How do you ensure the safety surrounding that in terms of inconnu? And finally, how do you safely perform identification with a newborn? So those are some reflection questions that if you feel it is appropriate with the team, please feel free to discuss this with your team. I did not have results from the patient satisfaction survey yet, so if there's anything new that comes out of that, I will share it with the group. This is a process, a slide from last year. It should not be a new process because we've implemented this. First, a sample for type and screen blood bank is obtained. It's sent to blood bank where an error has been identified. An incident report is generated by transfusion safety, and this is communicated to the unit and the ADON. Unit meaning the nurse manager and educator who are involved of that unit, and the ADON, and then a follow-up and retraining is requested. A retraining is a repeat of the raw blood in tube module, the AN module that is available. And so this is a new process that we have implemented since last year. As you can see, there were 611 sample errors. So obviously, like from blood bank perspective, a raw blood in tube incident report is generated and communicated for those specific incidents so that results can be sent back to the different various bodies to close the loop. I think what's really important and what I've seen in exchanges and emails and even through myself is really the stories that are around it. And raw blood in tube, I think we all know what the best practices are, but in reality, in clinical reality, it may be more challenging to apply it. We know that we should be doing signing at the bedside, and we know the current realities of the various teams. So what I would propose for the group is perhaps to use these stories and look at the incident of one incident and the process throughout each step and see in which process can you try to minimize the risk of error. Obviously, there are environmental factors also. So I have full trust that you're preaching to your group to follow best practices, and sometimes environmental factors are slightly harder to change immediately. So what I do suggest is really to look at each of your incident report. Use one case as an example to look at the whole step, the whole process, maybe map out to see where there's specific gaps that could be improved in the meantime. This is a new thing. This is a tip sheet that's available on the internet, just a general guide of when you have an event, a checklist of what to review, different questions to consider, improvement, and discussions with your team to investigate this error. So it's a tip sheet that is new for this year. Again, this is an example of an action plan uh, that could be applied. I think first off is probably sharing the results with your group and looking at your specific clinical area to see your rates compared to previous years. Usually we have raw blood and tube updates every 6 months. So the next update that I will generate is in the fall time. And there's for nurse managers reviewing the incident report, maybe discussing this at one of your huddles, using one of the examples so that the story may speak more to your staff and more relevant. There's training aspect where all individuals are doing the raw blood and tube during the orientation and a repeat if needed. If you have an APN in your area to support the teams and improvements. And nursing team is to generate the ideas and try to minimize the risks in the clinical environment. That's the end of the presentation, but before I answer the chat and the questions, I will just share my intranet page so that you can see how to access this. So if you go to Team Resource, I'll walk from the beginning for everyone. Team Resources on intranet. You go down to soins infirmiers in French or nursing in English. Once you go down here, you go to quality improvement in English. French will be amélioration en continu. And then once you're at this page, you'll see all the different spotlights. So you'll go into wrong blood and tube. The reports here is I'll open it. It's available. This is the SWAY that was sent out last week. So you can review that. And then I just wanted to show you this one so that you can see what I mean. So in this part, these are the graphs where you'll have the mission rates. And then for each of the mission, you will see your specific units. And again, you can compare for the last 3 years, how many blood tests was drawn on that unit, what was the rate of sample error and raw blood and tube. And you can do a comparison over 3 years. So same principle for every mission in terms of the results. And in the second part of the report is related to incident reports. So from here, what I first did is I gave you some of the real examples that I have gotten from the incident reports on each of the categories and what does it mean for each of the categories. And as you go further in the presentation, you will see the different types of graphs that are available. And I did one general transversal interpretation. However, if you'd like specific details, please feel free to reach out to me. I'll be happy to give that to you. So there are different graphs and presentations related to the incident reports. Some of the graphs, you'll see a number, an absolute number, if that is important. And some of the graphs, there's an absolute number and a percentage so that you know what percentage it is. So this is a report that is available on the intranet. For the Kahoot that we just did at the beginning of the presentation, you will see it over here that says training material, Kahoot game. The tip sheet that I shared earlier is also available. And some of the resources that were available since last year, such as the video about double identification, the ENA module, it is available for here in training material. That is all that I would like to share and what I had prepared in terms of presentation. What I will do now is I will take questions. So let me look at the chat. Where would you find the Kahoot, Jerica? I hope I answered your question. It's on the intranet, team resources, nursing, quality improvement, raw blood and tube, and there's a section for training. And what's included in the other, Maxim? I hope I responded to your other question. In the internet report, I gave various examples of other. Mostly it's transport errors. I hope that answers your question. And Cindy, Cindy, in the lab process, who communicates the information to the unit and ADON? Do you mean the rest of the central lab, Cindy, or do you specifically mean transfuse blood bank?
Blood bank.
Blood bank, it's Jeannick Collet, who is our nursing consultant in transfusion safety, or Bernard, which is our transfusion safety critical officer. And in the spotlight, there's a little shout out actually related to transfusion safety, who is in that department. So there are two clinical advisors, and then I don't want to get their names wrong. So let me just make sure I'm saying their titles properly. There's a nursing advisor for transfusion safety. There's a clinical transfusion safety team and a technical transfusion safety team. And then in this way, you'll be able to see some of the roles, what do they do behind the scenes, and some of the work they do. I'll share my screen just so I can direct everyone to it. So in this way, you'll see a little description of what they do. And you'll have their contact information as well. Does that answer you, Cindy?
Yes, thank you.
Okay. Megan, are there any stories of patients in the MHC or province where people were injured from wrong blood and tube given? Okay, so good question. So I think good news is that from quality, there were no major sentinel events or coroner's report related directly linked to wrong blood and tube. I'm not aware of other provinces. However, if you, I think one of the most touching things, I'm going to call their names out, is actually Siva and Martin Sills, and they gave their testimony of an incident they were either involved in or aware of related to wrong blood and tube. And those stories are so impactful because we can imagine it, and we can imagine the impact that it has on a team when there's a wrong blood and tube. So I encourage you to go on the module and listen to both of their testimonies. I'm not sure if I know Jeannick and Bernard are on the call right now. I'm not sure if they are aware of any other patient stories from other provinces.
No, I'm not.
Okay. Colin, Michael? I don't hear you yet. And I cannot find you right away on my screen yet. Okay, well, if you feel free to chat or try to open up your mic again. Any other questions for me? Okay. All right. If there are no more questions, I will close it here. Thank you for joining this afternoon on the Wednesday, and this recording will be available on the intranet as well. And please feel free to reach out to myself, Bernarda, Jeannick, and Aaron Alexander if there's any questions as you start looking at some of your reports, or if you like to look at the rates. Okay, have a good day.